and is recording the meetings so that it will be, each meeting recording will be publicly available. So I sent out an agenda to this group just the other day and got a couple new and important things to cover. And so we're going to do a little bit of setting, make sure we're all on the same page about the role of this group and prevention planning and what's going on there. I'm going to cover some important county and state updates that are new since our last meeting. And then we're going to launch right into a discussion that begins linking some of the preventative strategies that we've been working on in our 5-year child abuse prevention plan with the opportunities, the very specific opportunities that exist with FFPSA funding. And that is basically the sum total of our meeting today. And so again, why are we all here? We are the FFPSA leadership group. This group is responsible for the oversight and implementation of future activities that are funded through FFPSA dollars. It is having a community group and these partnerships pulled together and leading the decision making is an important and required part of our local FFPSA planning efforts. And we want to use the 5-year child abuse prevention plan as our strategic direction. Many of you guys are involved in that planning effort, the separate meeting that is facilitated by Leslie Ann Hay. You've had front row seats to all the community input and participation that we've pulled together to help us now inform what has resulted in 23 strategies to help our community address child abuse and neglect. And so that is our guiding document, if you will, and we are going to, this group is working together to look at how we can further those broader prevention strategies through use of the FFPSA resource. So we're going to be, of the 11 candidate groups that the state has identified, we're going to be prioritizing which of those candidate groups we want to begin creating services for more quickly. We're going to select the evidence-based practices that will best meet that candidate group's needs. We're going to figure out the implementation plans and build community capacity together. And then over time, we're going to oversee the programming to make sure that it is of high quality and fidelity to the model. Oh, there we go. So some state updates. I received or I participated in a training about a week ago, and through a somewhat informal channel, the person that is in charge of FFPSA implementation at the CDSS, the California Department of Social Services, responded to a specific question from a county. And that question was, hey, I heard a rumor that there's a significant delay on FFPSA drawdown for client-specific work. Can you please clarify that rumor? And in that conversation, the state person shared that because FFPSA being able to draw down and bring in funding into our community through FFPSA, because that's tied to our ability to report to the state and then federal government. And because the state has not been able to construct a reporting system, and they don't anticipate being able to construct a reporting system, they are now saying that it will be June of 2025 until we can draw down what is called child-specific FFPSA funding. And so we can, however, begin drawing down funding new FFPSA dollars for training and administrative time, planning FFPSA and building capacity for FFPSA. But unfortunately, it is not likely that we will be able to draw down new funds for client-specific services until June of 2025. That was very surprising news. I've been trying to get that in writing, documented in writing from the state, but they haven't responded to my request in writing. And so at this point, it is the best information that we have to go on. And so I just wanted to share it with this group and take a moment for any comments or questions.
So Regina, I just want to share your disappointment and our disappointment after learning that in terms of how that information was delivered is one, and then this plan that funding won't be available until 2025. And I feel somewhat a need to apologize because we had wanted to move this through, and Regina and everyone in this group have worked hard this past year or two to get something in place sooner rather than later. And later looks like now it's going to be in about 3 years. So it's very disappointing to us. However, you know, we want to focus on what we can control. And so one of the discussions that Regina and I had was around, you know, the FFT pilot. Are we able to continue that? And the answer to that question is yes. That is our commitment, that we will continue with that pilot. And secondly, we are, you know, entering in the next month or so budget planning. And so we will look to see if there's any other strategies or implementation we can do without that child-specific funding. We just don't know what that will look like yet because this information is new to us. Just want to again acknowledge it's a big disappointment, and we will try to do what we can. And again, appreciate this group's work over the last couple years. And then, you know, there's also an opportunity to look at our prevention plan that Leslie Ann is writing for us and Regina, and likely will focus on our community plan versus FFPSA specific. So I just wanted to share that.
Thank you, Charity. Cindy, I see your hand up.
Yes, so the FFT, our investment in that is pretty extensive. And I know we have a 1-year pilot. And just for, I know like learning a new modality of therapy, especially something as like FFT, you know, I think it'll take at least a year before clinicians are kind of up and running and comfortable with it and able to practice it to some fidelity. So my question is, so are we going to be able to move forward with FFT the following year? Because since I know our pilot is for 1 year, so I'm just curious about that.
Yeah, thank you, Cindy. I believe that we are committed to operating the pilot for at least 3 years. We are committed to operating the pilot for at least 3 years. And the state has provided different block grant funding, and their intention is for us to use block grant funding. Block grant funding is simply like a lump sum of money that the state or federal government does give us for general purposes. And so they have given us what we call block grant funding to be able to administer different programs. And so that's what started funding FFT. And I imagine that is what is going to continue funding FFT. But yes, it would be not an astute investment for us to just do it for 1 year. And so our plan has always been to have it be a either 3 or 4 year pilot project.
Okay, great. Glad we can do that even without the specific funding that's going to support that. Thank you.
Yeah, yeah. Any other comments or questions? Donna?
Yeah, I just was gonna say, I wanted to say thank you, Regina, for sort of explaining to the other and Charity, the other places that we will leverage funds to do this work until that funding becomes available. I share, and I think this group probably shares with you, just real disappointment that's where we are. And frankly, at this point, really a disappointment that we don't have that even in writing. And I know you're trying to get that, Regina, but it was that this was something that was sort of stated in a meeting. It is unfortunate because I think we really, that you want something to be a little more upfront than that. So I know that was hard to bring to this group this morning. Thank you, Regina.
Hey, thank you, Donna. And it was hard to bring to the group this morning. And because our intention of bringing this group together and honoring everybody's valuable time in these ongoing meetings to talk about FFPSA has always been to implement it. I remember, I think our first planned implementation date was back in 2020. And so I appreciate the group hanging in there. We will be revisiting the pace of the meetings in order to continue our planning efforts, look at using alternative funding to be able to further our prevention services. It's just really, it's just really, really unfortunate that we're not going to be able to draw this down. And it really thwarts our planning efforts. At least that's how it's feeling in this moment. But we will continue on and we will get those beautiful preventative services in place. Okay, so we also are awaiting guidance from the state on what they promise to be a candidate assessment tool and a state training plan and guidance on monthly safety monitoring. This state guidance is critically important for our local planning because, just as an example, the candidate assessment will shed some light on what the state's intention is as far as the broadness or narrowness of the definition of imminent risk of foster care placement. That is a phrase and eligibility for candidates that is can be widely interpreted, right? What does it mean for a child to be at imminent risk of foster care placement? So we're hoping that the assessment tool will give us that guidance so that we can truly be clear on who is FFPSA eligible. And so still awaiting and hoping for state guidance there. That said, we do have something called the Comprehensive Prevention Plan, or CPP, that is due to the state in January of next year. So they are looking to counties to be able to articulate what our local planning efforts have been and continue to be. And so I am working with the probation team and some other partners to develop that CPP. And we are using the functional family therapy pilot as like our specific pilot project for the purposes of developing that plan and telling the state what our local efforts are looking like. Also, I just want to share that the CDSS, the California Department of Social Services, is really doing more to encourage counties to consider this prevention work, this FFPSA driven work, in coordination with other strategic efforts that counties are already leading. For example, they want us to think about prevention planning as part of the arc of the continuum of care reform. They want us to infuse our prevention planning efforts with principles and values from the core practice model. And they also want us to be sure to bring to the table partners from our linkages program. That is a program for families that are participating in both a CalWORKS funded program and have some participation in child welfare services. So they really want us to look at pulling those resources and that shared case planning together, both at a system level and at a client-driven level. So, you know, certainly all good ideas over the longer term, and we just have to kind of think and sit with those ideals and that coordination as we continue our planning effort. Any questions before I move on to county updates?
There was a question in the chat, I think.
Oh, thank you. Is the state considering SDM? Cindy, a great question, and I think so. But they don't say much about what they're considering, or they haven't yet, you know. But I've certainly heard SDM mentioned more frequently than any other potential assessment tool. I think that the worry about SDM is for the community pathway and for community partners to use the tool as an assessment tool, and is it really as relevant? And so that's about SDM. So as Charity and Donna both shared, we are absolutely committed to reviewing available funding for new prevention programming that's aligned with this group's prevention planning efforts. And so we are going to, as a division, we are going to try to look for, and we feel optimistic that we will be able to identify additional block grant funding to be able to bring to life some of the prevention planning decisions that we make. Also, as many of you are familiar with, we are leading the effort to create that community-driven 5-year child abuse prevention plan. You know, with the lack of guidance that we're experiencing from the state, it feels really good to sort of turn our head and look at the community input that we've received from over 300 community participants. We've gotten input through surveys, focus groups, and we had 175 participants join our prevention summit, the Strengthening Families Summit that happened at the end of September. And we got really great ideas. And what we'll see in a little bit is the synthesis of those ideas into strategies that we can really begin tackling, and that can really lead the way for FFPSA funded services. We still have a new permanent position that is on track to be hired by January of this year. This position will be leading the preventative services efforts, both for services that are within child welfare, for families that are referred to child welfare, participating in family maintenance cases, but also providing support and leadership for broader prevention services efforts that are happening in the community with our different community partners. And I just wanted to also share that we are partnering with the Child Abuse Prevention Council that is administered through CPI, the Child Parent Institute. This has been an advocacy group that's been around forever, and we are partnering with them together to co-lead the prevention planning effort. And a new implementation change that we've recently made is that minutes and recordings and handouts from both our prevention planning meetings and these FFPSA leadership meetings will now be publicly accessible on the Child Abuse Prevention website. And so, which is a much more outward facing, community friendly website. And folks that attended our summit are getting email blasts about it. And so we feel like it makes these documents much more publicly accessible. And we are going to continue with our work, you know, in a steady way. And so we have a meeting set on November 17th with some folks from this team that volunteered to do that in-depth data review of the 11 candidate groups. We're going to be looking at the disproportionality data around those candidate groups, ages, and just the intensity of need, if you will, related to those different candidate groups to help us try to make determinations about the highest needs candidate groups that we want to prioritize for preventative services. Any questions on the county updates? Okay. So just a quick update on our functional family therapy pilot. So this is, again, a pilot project that we are using block grant funds to provide services to families and practice the different requirements of FFPSA implementation. Child Welfare is partnering with probation and TLC Family Services. They are going to be the providers of the actual functional family therapy model. It's still in startup mode with the training happening beginning in January of 2023. And one important lesson we've already learned, it will take about a year, as Cynthia mentioned, for the TLC team to be fully trained and certified in functional family therapy. Until then, they are beginning to provide much needed family therapy services to referred clients, just not using the functional family therapy model. But even as they begin the training in the spring, they'll be able to provide family therapy services informed by FFT and under the supervision of the FFT clinicians. Any questions on the functional family therapy pilot or anything the folks from probation would want to add? Nani, I see you.
No, I just would like to add that I think just looking at the FFPSA delay stuff that you shared, and I mean, we're all very sad, but when I saw the list of services that they were considering, I mean, the bar is quite high for evidence-based services for training and certification and keeping things to fidelity. It's a lot of setup, as we've seen. So it's very unfortunate about the delay, but I'm also not entirely surprised. So I think, like you said, we just need to keep plugging along and keep trying to get the services out there. So that's all.
Okay, thank you. Okay, so with that, I'm going to change gears a little bit. We're going to start talking in more detail about the strategies identified through our big, broad-based child abuse prevention planning effort. So again, we've got strategies now developed, and they are in the process of being prioritized by our leadership team. And they relate to broad, big picture child abuse prevention, both, with a focus in child welfare, but also a much, much broader community focus and really around primary, secondary, and some tertiary child abuse prevention efforts. And so there are 7 different areas or objective areas that are covered in our 5-year child abuse prevention plan. And strategies in 4 of those 7 objective areas can be supported through FFPSA funded services. And those 4 objective areas are improving access to family supports, building parenting capacity, expanding mental health, domestic violence, and substance use disorder services to meet demand, and strengthening culturally relevant services and supports. And so I just want to stay on this graphic for a minute to really make sure it's clear for this group that what we are producing as a community is a community-driven, community-centered 5-year child abuse prevention plan that is entirely and only reflective of community voice and the ideas that those 300 participants brought to the table as far as what the needs were, what the best strategies are to be able to address those needs. And FFPSA funding just so happens to be able to be used for some of them. Not all of the strategies that the community identified, but certainly some of them. And that's a level of detail that I'm going to share with you here. But I just want to make sure that that sort of intersection between our broad prevention planning and what we're able to look at in more detail and align with FFPSA funding makes good sense to this group. No questions? Okay, well, with that, I'm going to change gears and share something else. And if you could send that document to this group or put it in the chat rather, that would be great. And Donna, I see you've got a question or a comment.
I did, just kind of related to what you were sharing, and it kind of that idea of like the community-driven prevention planning and where we can fund through FFPSA and where we maybe cannot. I want to just underscore the commitment to wanting to do what the community is telling us we need. So yes, there's a piece of it that we will do, a large piece of it with FFPSA. It does not mean that we're not going to do the other pieces. It means that we're going to just have to figure out other ways to do them. The commitment is that we are moving forward with a prevention plan driven by our community and what our community needs.
Well said, thank you. Anybody else with a comment before I go back to sharing screens? Okay, so here is a document. I'm going to spend just a second orienting you to it, and Anne has also put it in the chat for us. And so the community identified 23 strategies in those 7 different objective areas. The objective areas are investing in addressing basic needs, improving access to family support, building parenting capacity, expanding mental health, domestic violence and SUD services, strengthening culturally relevant services and supports, creating more prevention partnerships, and finally, increasing youth-specific prevention efforts. Now, there's terrific strategies in each of those areas, again, 23 in total. However, and those can be, if you happen to be somebody that is not on our prevention planning effort and you'd like to see that whole list of 23 strategies, just put something in the chat and we will send it your way. But what I've done here is, because we're talking about FFPSA eligible services, I've taken only the strategies that are potentially eligible for FFPSA funded services. And I've pulled those over into this document. And so what you'll see here, for example, is the first strategy is straight from our prevention plan, and it can be aligned with FFPSA funding. So I'll take it in just a little more detail. This particular strategy is assign parent mentors as early as a prevention response. Expand existing parent mentorship, community health worker programs, and promotores to support system navigation for parents. Train senior or elder volunteers as system navigation partners and mentors to strengthen families' natural support network. So there is a lot of things that can be done, right, as a community. And actually, these things can be done as primary prevention efforts, secondary prevention, or tertiary prevention. Parent mentors and that sort of concept of a support network could be used in all different ways and for all different services. So now thinking about FFPSA, well, my goodness, we could use this concept to inform services for any of those 11 FFPSA candidate groups that are eligible for services. It could be youth involved in probation services and their families, families with family maintenance cases, children with siblings that are part of the foster care system. Those are just a couple examples to get people's minds clicking about who those candidate groups were. Those are a couple examples of who the candidates were. And then further, here are the evidence-based practices from that list of 10 state-approved evidence-based practices. Here's the ones that we'd be able to use So for example, parent mentors could be trained in motivational interviewing. We could draw down funding for their time spent providing motivational interviewing services and use that to create programming. They could, instead of motivational interviewing, they could use the evidence-based model of Healthy Families America, or they could use parents as teachers. Finally, in this particular example, I had to add Triple P because, as you all know, Triple P is sort of an inherent part of the fabric of our parent education services here in Sonoma County. We have invested in it for well over a decade. So while it is not a part of the approved state plan, I had to add it because maybe someday it will be. So does that linkage between one of the strategies from our prevention services plan and what the possibilities are related to FFPSA, does that connect for everyone? Or does anybody have any questions about it? Okay, and then a last piece to orient this group to. So as I shared, there's 23 strategies right now that were identified and grouped together based on all of the input. That feels, given the complexity of these strategies, that feels like a lot, even for a 5-year plan. And so we are right now soliciting input from the prevention planning leadership team, as well as from the folks that participated in the Strengthening Families Summit. We're going to use that input to prioritize within those 23 strategies and narrow it down to probably around 10 or 15. And so these strategies that are in the peach color are the ones that so far have risen to the top of the priority scale. Does that make sense? And so as you take a look at this handout for yourself, and go, as we go through it here, I just want to take some moment and have some discussion about the observations you have and what this could mean for our local planning efforts. So for example, one thing that I realized as I was creating this is, number one, boy, most of the strategies that we've identified as a community really can be applied to all of our candidate groups, or at least most of them. And so it really, no matter which candidate groups we end up prioritizing, we will be able to further our prevention strategies by providing them services. Another observation that I had is that motivational interviewing really is so widely applicable to be able to create resource and provide services that address so many of our prevention strategies. I hadn't realized before putting this together that it really could be useful for doing all kinds of different things that again, create resource and capacity to further these different prevention strategies. Cindy, I see your hand up.
Yeah, so I was just kind of looking through it. I haven't had an opportunity to read through this, very closely, but I was kind of wondering some of the strategies that are not necessarily highlighted in peach. Do we have any that are already existing or existing in some form that we can build up? Do you know what I mean? So they're already existing, like I know public health nurses. I'm trying to move yours up. That do visiting are also trained to some extent. I believe a few of them are trained in like Triple P. So I'm looking through some of the, like I said, ones that are not highlighted and say to what extent are they already existing. Like I'm looking at number 5. And I'm thinking we already have, a lot of home visiting with public health nurses. I know, you know, we can make the referral, or hospitals can. And they also provide some of them like triple P or parenting support. So can we build on those that are already existing? That's my question.
That was, Cindy, a terrific segue. You actually just shared one of my potential questions for discussion.
Okay, you can
It's
give me
really
the-
looking at these and identifying, and nurse family partnership is a terrific example. Where is it that we have community capacity that we could potentially, make faster work of creating additional capacity or stabilizing a program, something to that effect. And Jamie, I see your comment in the chat, so thank you. And yes, I have heard that they have that long wait list. So that's a great point. Donna, I see your hand up.
Yeah, it was just, one of the things that I really appreciated when we went through this list and as we were sort of looking at it, I mean, one is, I think, as you read through it, my experience of reading through it was like, yes, like this, it's so rich, and it is all the things that I hear from families, from our teams about what families need and what does and does not exist in our community. But specifically around some of that home visiting, I think I wanted to lift up the piece universal, that word universal, because one of the things that we talked quite a bit about was this, and I think came up here in this work, is the idea of normalizing helping families, normalizing that all families need help, that all parents of newborn babies need some help, need some resource, and that if we can destigmatize that idea, so universal home visiting, if every single baby who went home from the hospital had a home visiting program, what might that look like in our community? And I do think there's a program to build off of. They don't have the capacity to do universal home visiting, but what might it look like in our community if we did that? And if every parent, every family got that level of support when they brought a baby home. I think I just wanted to lift up that piece about, kind of the whole community and wellness across the community.
Yeah. Thank you, Donna. That was perfect. Other thoughts or comments?
I was just looking or listening to what Cynthia had to say sort of about what we already have in place, and I see motivational interviewing listed a lot throughout. And thank you, Regina, by the way, for pairing the practices with the prevention strategies, because I think that's so helpful to see how we could line it up. So my question was, and maybe the answer is not there yet, but I do know we do a lot of solution-focused interviewing through safety organized practice already. But it's also not motivational interviewing, but it's fairly close to that as a practice. So how much is the state going to be looking at sort of the fidelity to the practice that they're asking for? Or is there room for maybe looking at solution-focused interviewing as one of the practice models to support motivational interviewing? Or are they saying that people have to be trained through like the lengthy motivational certified training and, show evidence that they're adhering to that model?
So great question, Jamie. And at this point, the state is very clear that we need to maintain fidelity to the specific evidence-based practices. And to the point of saying that there's definitely not room for flexibility. They really want that fidelity maintenance, and that's sort of a directive that's coming from both the state and federal government. And so, like, if we were opening something up at this moment in time, I would say that we would need to transition to motivational interviewing clearly in order to draw down FFPSA funding, if that was our draw. And I mean, I suppose one of the silver linings of the news about the delay in being able to draw down state funding is it gives us time to see what else ends up in the clearinghouse and what may potentially be a part of the state plan. But I think just to be able to put our feet on the ground somewhere, we should stick to these 10 evidence-based practices that the state's already moving forward on. Other ideas or observations about connections between our broader prevention strategies and FFPSA eligibility?
Yeah, Regina, I think, given that our timeline has adjusted for FFPSA, but we can still draw down dollars for training. I mean, I think we've kind of said it already, but it seems like a large community investment internally and externally for motivational interviewing is warranted over the next couple of years so that we are primed for when we can draw down for candidates in 2025. Similar, we're practicing FFT over the next few years, but I would say MI is something we could actually train more broadly because it's not as specialized as FFT, so that we could have multiple service providers and internal staff really understand it and utilize it as soon as we're able to draw down those dollars.
I think that's a great observation. What do others think about the use of motivational interviewing specifically?
Well, I think one thing that's nice about it is because a lot of our social workers are trained in solution-focused interviewing, it's not too far of a stretch because it has a lot of similarities in it. So I think, it wouldn't be like a steep learning curve for our if you were looking at our social workers to train, for example, like it wouldn't be a steep learning curve, I don't think.
Mm-hmm. I think what I like about it is that it feels like a vehicle to be able to bring in resource to fund other services. So I really see it as the realistically best opportunity to bring in other more equity-driven resources and practices and programs that don't have a different evidence-based practice attached. But if we can create networks of supports and mentors and natural connections that are, in all areas of people's lives and in places where people are comfortable going, I just feel like motivational interviewing is a great vehicle for that. Jody, I see your comment in the chat. And Cindy as well. Cindy, are you saying that motivational interviewing expands our base of candidates?
Yeah, and I'm saying that because with FFT, it's specific to like 12 and above, and it sort of identifies some acting out behavior. So we're really limited as to who we can serve. Whereas with motivational interviewing, I think it's much more expensive. And so I know they still have to be specific to a candidate, but we can definitely expand who we're serving in the community. It doesn't necessarily have to be a teen that has some, out of control behaviors and the family can't manage it.
Right. I've got you. Thank you. And then Jody, thanks for the connection to the UC Davis training. I think that sounds great. Yeah, and certainly a place to research. And Brad, I saw your hand up.
Yeah, I do think it's take advantage of the opportunity that we can draw down training funds and look at training in MI. The question is, are we looking for a provider? Are we gonna do we have to do an RFP to see if we're gonna provide like a consistent training across agencies and across providers and have that monitoring? Is there a train the trainer type program where we can train internal staff to deliver that? I mean, those are the type of things I think we should start looking at, because we can get that training in and get everybody up and running for when we're able to do the child specific claiming.
I like it. That is very actionable. I appreciate that. Are there, before I move us on, Donna, I see you've got your hand raised.
Sorry, I feel like I'm particularly chatty this morning. So sorry. I think one of the things that we'll want to think about in that kind of conversation is with motivational interviewing, when I think drawing down funding for our staff versus drawing down funding out into the community. And so I think that's just an important conversation for us to continue to have. I think ideally the hope is that we're moving money out into the community. And so how do we get the most money out into the community in that way? And maybe some of that is internal with the motivational interviewing piece. But I want to keep that piece in mind that I really would ideally want to see as much of this money going out into the community as we can.
Thank you, Donna. And then I see those other comments in the chat about a question whether we can access UC Davis training. And then Cynthia's observation that our CBO partners have been asking for motivational interviewing training for a long time. And that has always been a value that we've had as a county agency, is to really an acknowledgement that we can't simply request people to implement evidence-based practices, that we really need to provide sustainable support and capacity building to help make that happen and support our community-based organizations. And so, Jamie, thank you about the BAA providing the MI training as well. So I think did anybody else have last comments about the linkages or possible strategies or ideas or brainstorms that you'd come up with? So I think when we think about actionable next steps, I have a couple in mind. First off, again, going back to our broad prevention planning work, we're going to continue to work as that broad prevention planning team to narrow down the strategies that are going to be included in the 5-year prevention plan. And now, as part of this FFPSA group, we've got that meeting on November 17th where Dominic's going to be presenting more specific data about those 11 candidate groups. And my hope is that group that's meeting on the 17th will be able to get the information they need and talk about it and bring their own expertise in to say, okay, so here's the candidate groups we should really focus on for, first as the highest needs groups. And so that's what I'm hoping that path of work will look like. Secondly, I'm hearing a request to do a little bit more research and share information specific to motivational interviewing and what that would look like to be locally implemented. Does that sound right? So I think that we can make that happen and get that information back to this group by the next meeting. Is there any other sort of research or information, big questions that taking a look at those strategies has created for you, or potential partnership areas that you'd like this team to explore?
So sorry, now I feel like I'm doing all the talking. So I know Bay Area Academy did like a 1-day motivational interviewing, and Jamie, you said they had a 2-day. But my understanding of motivational interviewing, to really be able to do it, it takes, more extensive training in order to be competent in it. So I'm just kind of curious, what that would look like for us to do a training. So I don't know if you can get certified in motivational interviewing, but so people can kind of practice it to fidelity versus offering, the community a 1-day or 2-day. So that's just what I wanted to put out there. And I don't know if you had an answer to that, but,
I don't. I know that the probation team taught me years ago about the differences in implementing motivational interviewing, services informed, engagement practices informed by MI versus really doing it to fidelity, and that there is quite the big continuum. And to be clear, in order to draw down FFPSA, my assumption is that we would have to be providing it with fidelity to the model, which may require more than the existing Bay Area Academy trainings. But that'll be our research to do and to bring back to this group at the next meeting. Other comments, questions? is there interest in pursuing taking a look at nurse-family partnership? Or, inviting public health to be a participant in this group to see about, talking more about expanding home visiting capacity, or do we really want to focus on motivational interviewing?
Is there room to do both?
We could absolutely take a look at both. And as we've seen now, sometimes one idea can be seen through and another idea can't. So we could certainly try both options. And I do think it would be great for us to have a partner from public health on this team.
I can ask Liz George, because she sat on our collaborative meeting and she's involved with like planning of the perinatal alliance things, and this is kind of right up her alley. Would you
Oh,
like
that'd
me
be
to
great,
reach out to
Jamie.
her?
Thank you.
Yeah.
Perfect. Any other last comments or questions as we end today's meeting? Okay, well, given that the holidays are fast approaching and that our time frame has slowed down, I am considering, I had put a December meeting on the books a couple months back, wanting to make sure to get a meeting in place before people's calendars were too impacted. But I'm thinking I'm going to cancel the December meeting and then we'll just keep the January meeting as scheduled. Does that sound okay to this group? One less meeting in our lives. All right, we'll go with that then. Any other final thoughts or questions? Okay, well, thank you so much for your time today and for hanging in there throughout this planning process. Have a great day.